Whose camera is off?
Whose camera is off?
Do you mean it's on nobody camera? to you from Fox News 5, and today we're about to get started. It's a pink day. It's pink day. It's it's a breast cancer awareness pod. Oh my goodness. Hi, good evening. It's Chevrolet from Nevis Newscast. Oh. Hi, I'm Chevrolet. What about you? They could hear me? Hi, it's Chevrolet reporting from Fox News. You like that propaganda news? Okay. From the BBC. This is Chevrolet from the BBC. About that sound better? More valid?
You're really doing good.
Doing much better. Much better.
It is.
Fox News.
Oh my God.
Can they hear? She couldn't hear us a while ago. She couldn't.
If you can hear, just give me
Hold on to your phone.
Dr. Grant, mic muted.
nothing yet.
Something's muted? It was based on what I said.
Oh, somebody messaged me and said they're hearing everything. Somebody on the live. Chevrolet speaking. This time I'm not from the BBC. Hi, it's Chevrolet from Nevis in the pink room.
They can hear you.
Dali, ako sa nito yung Gmail ay namata.
Just right here. There's Chevrolet is coming through loudest reporting from
I'm in the right position here. Good. Good evening to all of our viewers and listeners, and thank you for being patient with us. We had a few technical difficulties, but we're here. So thank you for joining our Breast Cancer Awareness virtual podcast on the topic Breast Cancer, Sexuality, and Intimacy. I am Ms. Shavani Nisbet, Senior Health Educator at the Health Promotion Unit on NEVIS, and I have the pleasure of welcoming you to our podcast. Breast cancer is acknowledged in the month of October and adorned by the color pink, hence we call it Pinktober. The theme for this year is Body Up to Beat Breast Cancer. This evening, we have a panel of three lovely ladies. They are Dr. Marissa Grant Tate, oncologist, Mrs. Kamara Lee Prentice, breast cancer warrior, and the Honorable Hazel Brandy Williams, Minister of Health on NEVIS, and she will be our podcast moderator. Dr. Marissa Grant Tate was born on February 2nd, 1979 on the island of St. Kitts. In 1998, she traveled to Cuba, where she attended the University of Cienfuegos and subsequently the Higher Institute of Medical Sciences of Camagüey. There, at the age of 25, she successfully completed general medicine. In 2005, Marissa Grant, medical doctor, returned to the Federation of St. Kitts and Nevis, immediately contributing her skills within the Accident and Emergency Department at the Joseph N. France Hospital. She was subsequently promoted as head of department and served in said capacity for the latter of 7 of her 10 years of service. In September 2015, she enrolled as a resident of oncology at the Latin American School of Medicine, Havana, Cuba, and graduated successfully at the top of her class in medical oncology in May 2018. She then completed postgraduate studies in radiation oncology and subsequently in clinical research and scientific communication before finally returning home in 2018. She holds the distinguished honor of consultant oncologist at the prestigious JNF Oncology Unit and also successfully manages her private practice, WellPoint Medical and Oncology Center. A strong advocate of cancer prevention, she also serves in capacity of president of the St. Kitts Nevis Cancer Society. She's a published author and an active member of both the European Society of Medical Oncology and the American Society of Clinical Oncology. Mrs. Kamara Lee Prentice is a daughter of the soil and the founder and CEO of Talent Plus, which is a recruitment and human resource business in St. Kitts and Nevis, launched in June 2020. Prior to launching Talent Plus, she held a number of human resource positions in St. Kitts, Nevis, and Barbados. In March 2018, Kamara was diagnosed with early-stage breast cancer. Today, she is thankful to be a breast cancer warrior and has taken on a new interest in championing the cause and creating greater awareness about breast cancer, especially in young women. Through her journey, Kamara also supports other young ladies who are facing breast cancer or any type of cancer diagnosis. Kamara holds a Master's of Science degree in International Management, as well as a Bachelor of Science degree with honors in Management with Psychology, both of which were obtained from the University of the West Indies, Cave Hill campus. She is also a certified professional by the Society for Human Resource Management, SHRM. I will now turn you over to our moderator this evening, who is the Honorable Hazel Brandy Williams, Minister of Health on the island of Nevis.
Thank you very much, Ms. Chevrolet, for introduction of the panelists for this evening's podcast. I want to apologize for the very late start. We had some technical difficulties, but we are now here and we are ready to start. So those persons who are still on, share the live, get as many young women and girls as possible in the Federation to join us as we discuss our topic this evening. We want as many women as possible to join in. I am certain that the good doctor and our cancer warrior will impart some very important information that we can all use. So Now, here we are. Let us get into this lively discussion. Good night, Doc. Good night, Kamara. It is a pleasure to have you with us tonight. We do appreciate your presence. We appreciate your time, and we know that time is important. So we thank you for sharing your time with us. Good evening. Doc, let's start with you. We are here, this is October, when we celebrate Breast Cancer Awareness Month. As you know, breast cancer is a somewhat taboo topic because it is scary for most persons. So could you start by telling us, explaining to us, what is breast cancer? I'm not hearing you, Doc. Check and see if you're on mute.
But she might unmute. Yeah. Okay. Okay, she may not talk. She talking now? She did.
No, it's not.
Yes.
It's actually not.
We can hear you.
Yeah. Okay.
We can hear you. Go ahead.
Yeah. It's not muted.
We are hearing you, Doc. We are hearing you. Go right ahead.
Are you hearing me now?
Yes, we are.
Okay. I was saying that breast cancer is, simply put, cancer of the breast, and I suppose we would have to look a bit more specifically at what exactly is cancer. Cancer is where we would have had a single cell that would have been transformed from what would have been a normal cell in terms of how it functions. It loses its ability in terms of being able to die. It loses its ability in terms of being able to stay at a particular size. And by what would have been mutations that it would have gained, it continues in what is basically an endless life cycle. It also then too earns what is the capacity of being able to spread to the rest of the body. And so breast cancer is that specifically that originates within the tissue of the breast.
Okay, you said that the breast cancer is a normal cell that changes its function through mutation. And so what would be some of the signs that you look for if you are to, when you're doing your self-checks on a monthly basis? What are some of the signs that you look for to show any changes?
So overwhelmingly, the principal sign of breast cancer is the lump. In well over 90+% cases, that is actually the principal sign. And so this too is also the reason why we emphasize on what would be monthly breast examinations, since it is that once it is that a woman is familiar with the composition of her breast, then she would be able to easily detect and quickly detect what is a lump, a bump in the breast, and then be able to get what is an early diagnosis. So that is the principal sign. We have other signs that come along as the cancer becomes more advanced. Being whether it is a change in the skin, it can gain what is an aspect that looks somewhat like what is an orange peel, and it actually mimics that name, what we refer to as peau d'orange. It can also present itself with a discharge through the nipple. That discharge, it may vary in terms of the content. In some instances, it may be bloody. In some instances, it may be blood mixed with what is a purulent or pus-like sort of substance. And basically, those are the principal signs that you would see along the lines of locally. And of course, too, then there are other signs that would come about if it is that the breast cancer then spreads to other organs.
Okay, thank you. Kamara, you are here as a breast cancer survivor, warrior. As the good doc would have just outlined, could you kind of give us what was your experience? What did you feel when you discovered that you might have had something
Yes, thank you. Are you hearing me?
Yes, I'm hearing you. Go ahead.
Hello?
Yes, I'm hearing you.
Okay. As Dr. Tate stated, one of the most common signs is the lump. Well, I actually discovered so I felt a discomfort in my breast and then subsequently examined my breast and discovered a lump. After feeling that, I then went to the doctor to get examined and so on. And from there, I went through a series of scans, um, and biopsy, which in the end turned out that the results returned cancerous. And so mine was actually in the form of a lump.
Okay, so when you felt the lump and you decided to go to the doctor, were you expecting a diagnosis that you got, or you just went because you were curious as to, what was really going on with me?
I wasn't expecting such a diagnosis at all. It was a discomfort, it was a weird feeling, and I just wanted to know what was going on. And so I went to the doctor to find out what it was with no thought or idea, thinking at all about breast cancer or anything cancerous. And so I went to get checked out, wondering what this could be. And, from there, they recommended a number of things which turned out to be cancerous.
Okay. So, Doc, a young lady walks into your office and they feel that they have, detected a lump. What sort of examinations would you do before you can come to a diagnosis? I know as women, we tend to self-diagnose ourselves at times. So, what will you do from your standpoint before you can, come to such a decision?
Well, first of all, it's important to point out as well too that in most cases, well over 80+% cases, the woman herself is actually who would detect the bump or the lump in the breast. And so then it is actually very unusual that a woman who may, for example, walk into a doctor's office not having yet noticed that she would have felt a lump, and then you have a doctor point out to you and say, hey, that here is a lump. And so that is actually a more unusual instance. In respect to the examination itself, or the series of examinations that we would undergo, we would emphasize first, obviously, on what is a breast examination, a medical breast examination, looking to find, what would be, whether it is a lump in this instance, whether it is that, this is actually something that is present at this point in time. Apart from that, too, I would say that we would also emphasize on the age of the individual. Even though it is that breast cancer is something that may be present within just about every age group in terms of adult life, we know for a fact that generally it is much more predominant in what would be the premenopausal woman. So a woman who is not yet quite in menopause, but heading there. So, in what would be around the 40s, late 40s in particular, about 47, 45 to 47, that is where we have one of the highest incidents in terms of overall incidence. And then, too, we also have what would be along the lines of with the postmenopausal woman. So, after the age of, say, about 60, we have what is another rise in terms of incidence. And so then, if it is a young woman, we tend to think, no, this is probably not going to be breast cancer, but we have to be absolutely certain and we must investigate. And so then we would emphasize and have what is a biopsy. Well, sorry, before the biopsy, you would actually do, or you should have, an ultrasound done and a mammogram. The mammogram really doesn't pick up much if it's not a cancer. It really doesn't pick up much in what is a younger patient based on what is the fat content in the breast. But this examination should be done if it is that the ultrasound shows something that is positive, or suspicious rather, for what would be a cancer. And then if it is that the mammogram or the ultrasound, as I said, indicate that we probably have what is a cancer, then a biopsy should be done to be able to confirm the diagnosis.
Okay, doctor, you said that most cases we find in women who are premenopausal, but we have
Right.
seen the statistics showing that younger and younger women are, being diagnosed with breast cancer. Is it then should we change the narrative then, or it is just some abnormalcy with younger persons now being diagnosed?
Well, well, the truth is, sorry. Well, the truth is, only about 7% of cases are diagnosed before what is the age of 30. And this is something that is, cancer statistics are something that are, well collected, well documented. And so, although not impossible, the truth is only about 7% of the cancer cases would actually be, say, before the age of 30. So I wouldn't say that we have to change the narrative, but obviously there are other factors that we would have to look at, and particularly in what is a younger woman, then we want to look at what would be the family history, whether it is that there might be a history of breast cancer in the family. That is something that can predispose a younger woman to having what is an earlier incidence in terms of breast cancer. And also, too, there are other related cancers that may be associated with, some of the gene mutations. I know that many of us, you would have heard of BRCA1, BRCA2 mutations, for example. And so, instances where someone may have this mutation, it may not have been tested, they may not be aware of it, but in some instances you can have where perhaps what might be several aunts might have been diagnosed, whether it be with ovarian cancer, whether it is that they might have been diagnosed with breast cancer. And so then this can give what is, a higher reason for, or rather greater suspicion that there may be some underlying cause that is specifically contributing towards this cancer in a younger patient.
Okay, thank you, Doc. Kamara, you were in your late 20s, early 30s when you were diagnosed. So, could you identify with, one of these areas that doctor would have just mentioned, whether it's a genetic, it runs in your family, or what was your position? What give us an idea as to which bracket you fit into.
Yes, I was actually diagnosed at age 30, so I was exactly in that age range. So I fit within that, I fall within that 7%. And what I've realized is that the research shows exactly what Doc said, but I've realized in the Federation and even throughout the region, we usually hear of older ladies like in the 40s, 60s, and so on being diagnosed, and we never think about the younger ladies, 20s, 30s. But while it is rare, it is not uncommon, and there is a percentage. The research shows that it can happen to us, and I was diagnosed at age 30. I also know of and support ladies who were diagnosed at even age 28, 29, 27, and so these are things that I see happening before us. Doc also spoke about the BRCA mutation, and it is something that I am very familiar with because my journey, it taught me so much. And I actually have a BRCA mutation. And what it shows is that it's in your genes. What it is that it means that you are at higher risk for breast and ovarian cancer. And really and truly, it's not something, when we hear cancer or cancer diagnosis, we get scared. But there are things that we can do to be preventative. The first thing is knowing what your risk is, or your risk factors are. So knowing if it is in your genes, what your risk factors are, and paying attention and staying on top of it having your annual medical, your monthly screenings, and so on.
Okay. Doc, Kamara just used the terminology there, which is new to me. And I had a question, the BRCA mutation. Explain to us exactly what that is, because for me it is a new terminology, and I'm certain that a lot of persons who are listening might not have heard of this terminology before. So could you give us an explanation as to what the BRCA mutation is?
To be honest, the BRCA mutation, actually it's quite erroneous in terms of the term itself, because it actually stands for breast cancer mutation. So the presumption would be that, once it is that you have this mutation, um, as per the name that is, then, you would be, at risk, or that rather you would have breast cancer based on the name itself. But as Kamara said correctly, so it's not only associated with breast cancer, but another or other cancers. And so then we have, as she said, breast cancer. We have ovarian cancer. Those are perhaps the two more frequent ones. It's also associated with what would be endometrial cancer in what is the more elder patients. And even in some instances too, research now shows that it is also associated with what is prostate cancer. And so then a gentleman whose, mother or whose family rather, may have been affected with BRCA, they may not necessarily be aware of the fact that, this too also could increase what is the risk for prostate cancer even. However, the presence of the mutation does not specify that you will definitely end up with a cancer. I want to point out as well too that only about 20% of cancer cases are in fact genetically related, in terms of along the lines of your family history and so forth. One of the problems that we have is that we still have what is a very general sense of not me, or no, this doesn't run in my family. And unfortunately and overwhelmingly so, the majority of the cases are actually sporadic. In other words, not with any known family history, and not even with what would be any identifiable specific mutation.
Doc, I'm happy you touched that, because there are women who are still saying that, cancer doesn't run in my family. And so even if I feel something abnormal, they are very apprehensive to go, at first hand to get a different opinion as to what is really happening. So I'm happy that you touched on that. Before I go to the next question, I want to say to those persons who are listening that there will be a question and answer section. So do write in your questions so that I can have the doctor and Kamara answering and adding some flavor to this discussion here this evening. So, Doc, when persons come to you, when women come to you, they are told, after the diagnosis, they are told you have some stage of cancer. So we know that there are a number of stages. Could you kind of explain to us the number of stages and what happens at each stage?
I'll try not to bore you with the medical jargon, but in essence, there are 4 stages of breast cancer. There are 4 stages. And what we do is we consider what would be early cancer. Earlies, we have what would be stages 1 and stage 2. Stage 1 is obviously what is going to be one of the earliest stages of breast cancer. I should touch on as well the fact that we also have what is, in situ cancers, right? Where it is that the cancer is still located in what is going to be the site or the cell in which it would have originated. But we not only look at what would be the size of the tumor, but we also consider to a number of other factors. So we have to look at whether it is that the lymph nodes throughout the body are also affected, and whether it is that the cancer would have spread to any other organ. And so then based on that, we categorize the cancers into 4 stages. We have first and second stage, or stage 1 and stage 2, which are considered as early disease. And then we have stage 3 and 4, which is advanced. In stage 3, then by this time, then the cancer would have spread from what would be a more localized area, and it then starts becoming more regional. So in other words, then it starts, affecting what would be the lymph nodes and so forth. Generally speaking, it starts within the lymph nodes of the arms. And then stage 4, it would have spread to what would be another distant site, whether it be the bones, whether it be the brain, whether it be the liver, or whether it be the lungs. And those actually are the 4 most frequent sites that breast cancer tends to spread to. Not in that order, though.
Okay, all right. So once you have a diagnosis, what is the treatment plan? What kind of treatment plan, you put a person on?
Well, treatment not only dependent on what stage of the cancer, but it also has to be individualized. So you have to look at the patient that is before you, and apart from what would be obviously that of the stage, we also look to at and the beauty of cancer treatment is that it has evolved. And so then this is also one of the reasons why we see patients are able to, once they are able to access what is the necessary care, then you are able to have much longer overall survival rates. So in terms of the early disease, the first thing generally would be that the patient would need to have surgery. We also like to point out the fact that breast cancer is not curable once it is that surgery would not have been involved. However, surgery is not always going to be what is the first treatment modality. And this is, again, based on what the stage of the cancer is going to be. So what is a more advanced breast cancer, whether it be that it's not quite yet metastatic, it hasn't spread all over to the other organs or that sort, but it may be more extensive, where surgery in that initial instance is not going to be able to do the necessary at that point in time. And so then that particular patient would require what is going to be systemic treatment. And that generally comes in the form of chemotherapy. Again, too, based on what has been many of the, the advances along the lines of breast cancer treatment, we also too have to highlight the fact that based on what would be what we refer to as biomolecular basis of this particular cancer. So in other words, as Kamara may have had this particular finding with this particular breast cancer, and then you may have another individual who may also have breast cancer, but when you do what is the immunohistochemistry, in other words, the biomolecular testing, then there are differences. And so then based on these specific differences, you have patients who will benefit from what would be different forms of treatment, be it hormonal therapy, be it more targeted therapy, be it immunotherapy. And there are a whole host of areas where treatment has really advanced. But again, all of this is as a result of what would be very specific testing that would then determine the general form of treatment.
Okay, that was a mouthful and some over, Doc. But I could I get from you, Kamara, your experience in terms of your treatment plan? How involved were you with your doctor in terms of coming up with the best plan for you?
Yes, definitely. That points out treatment based on individual testing or the receptor testing. And in my case, it was very targeted. Um, First was for me to undergo surgery. And for surgery, my doctor presented me with a number of options. And I chose the very radical. And I chose that approach because of fear of reoccurrence. And that approach was a bilateral mastectomy, which was to remove both of my boobs. Now, many of you have heard my story. And, at the tender age of 30, at that time, I couldn't imagine myself breastless. And I wanted to have reconstruction right away. And at that time, reconstruction was not something that was offered in the Federation of St. Kitts and Nevis, or that I knew of rather. And so I decided to go to the United States for surgery and treatment so that I could have the reconstruction done as well. And there I underwent surgery in terms of the removal and the reconstruction, underwent chemotherapy. A part of chemotherapy, one of the things that they realized when they tried to administer the first round of chemo to me was that my veins were very weak and couldn't take the chemotherapy. And so I had to go back to surgery again to input a port, which is a small device under the skin, so that they could administer the chemo there. I was prescribed 8 rounds of chemotherapy, and I only did 6. I was stopped after the 6th one simply because I developed an allergic reaction. It wasn't severe, but based on the research, one of the things that my oncologist there said was that when you see early signs of certain things, you're supposed to stop the patient. And my oncologist and entire medical team felt comfortable stopping me at number 6 based on the early stage in which the cancer was caught. And so my treatment plan, as I said, it included surgery and chemotherapy.
Thank you very much, Kamara. To add to that, tell me how comfortable you were asking the tough questions of your medical team, because someone being diagnosed, it is hard to get that diagnosis in the first place, and then to bring yourself to asking the tough questions. How difficult was that for you?
It was very difficult. At times I felt that I think at all. And so, support is important when you're going through a journey like this. And so at each of my appointments, there was a family member, or, well, it was my significant other, that my husband now was present with me, for all of my visits. And they were able to help me to ask my medical team the right questions. What we also did is that sometimes you wouldn't think of everything that when you're with the doctor. And so I kept a notebook and I wrote my questions down. And so whenever I had my appointments, we would ask the doctor those questions. And we asked several questions because this is something that was new to me, and it would be new to anybody receiving such a diagnosis for the first time. You really don't know what changes you are about to undergo, what will happen, how you will feel, and those sort of things. So it's important that you ask your doctor all of these questions. It was scary, as I said. At times, I couldn't think of the right question to ask, but I had a very supportive team with me and were able to ask the right questions.
Very good. Write down your questions so you don't lose them. Doc, I will ask the first question, which comes from the persons who are listening online. Is it possible to heal cancer with diet and lifestyle changes? And I'm asking persons to send in their questions. We want to hear from you as well.
The question, it was if it is possible to heal?
Yes.
Heal. Unfortunately, no, it is not. Unfortunately, no, it is not. The truth is, and as I pointed out earlier, cancer is perhaps one of the most researched areas of medicine. And overwhelmingly, the guidelines, they have been constructed, and these guidelines are guidelines that change not only annually, but many times within the course of a year. Then physicians like myself have to constantly return to what would be updated guidelines to be able to effectively function as per what the data continues or what it might instead now show. And so diet and modification in terms of lifestyle, unfortunately, will not cure what is breast cancer or cancer for that matter.
Okay, thank you. We have another section that I want to move on to now, which is a little more involved. And as we would have said earlier, 7% of the 7% of younger persons are now getting a diagnosis of breast cancer. And because of that, a number of persons have asked the question, how do they know, or what happens to their sexual life? What happens to their intimacy with their partners? How do they deal with it, post-diagnosis or even going through the process? How do they deal with it?
Well, the truth of the matter is that breast surgery, even for a woman who would have been able to undergo what would have been, say, a partial mastectomy instead of having the entire breast removed and then having what is a presentation that is still pretty much in accordance to what we may have expected. But we know how it is, as a woman, even from day to day, what would be simple changes. If a pimple pops up, then this is something that can affect the way that we feel about ourselves. And unfortunately, the breast, which are considered to be organs that women we value, and we value them for many different reasons. Not only what would be the sexual aspect of it, but also too, this is one of the ways that we very early on bond with what would be our offspring and so forth. And what is a change in terms of the breasts would then affect us. As it would pertain to the sexuality, specifically, and how a woman would have to deal with it, I would say, and this too is also supported by what would be the studies, which is that support, overall support, whether it be through team support, professional groups, and just a very healthy support system, and obviously to what is a very supportive partner. One of the things that we know through the data is that couples, for example, who would have been together for, say, 15 plus years and beyond, they have what is a much lower rate in terms of changes in respect to what would be intimacy between them. And this is as a result, perhaps, of what might have been a relationship that would have been able to have thrived over a longer course of time. And so, again, I would have to say it really just comes down to how the woman is going to be able to adapt towards, her own body. She has to be able to embrace what is, her own sensuality. And that is something that we tend to forget about because, how she feels about her body. And sometimes, more often than not, too, the woman is perhaps a bit more insecure about the change than what her partner, in fact, might be. Although, yes, obviously, there are some few instances where we have known cases of, separation. But again, too, this is something that has been documented and that is shown to be, as a result, more of what would be pre-existing issues in the relationship before what would have been a cancer diagnosis. So in other words, as a result of whatever issues that predated this diagnosis, generally this is where you find greater rates of separation.
Okay. I'm just curious. Is that a question that you are being asked regularly? Do you get that question regularly in, general consultation?
To be quite honest, I think generally, as it pertains to sexuality, my male patients are perhaps the ones that tend to think of that more. I think when a woman is diagnosed with any sort of cancer, perhaps that is one of the aspects of life that is far removed from her thoughts. And so it is not a question that I honestly get very frequently from a female patient, even in terms of what may be continuation or resumption, of relationships, of intimate relationships. Then generally it would be the male partner that would, nudge in terms of, asking about, whether it is that this is something that is that they may now be able to proceed with, and so forth. So generally, I want to say that women on a whole, it is perhaps one of the last components that they actually think of at the time of diagnosis.
I'm happy that you mentioned the men because they have an integral part to play in the whole scheme of things. The support. And so no wonder that is a part, something that they will be very much interested in, moving forward. So I'm happy that you touched on the men. We have not yet spoken of breast cancer in men, even though it is less prevalent than that in women. I am told that we would have had cases, and it is on the rise, breast cancer in men. What could you say about that?
Well, breast cancer on a whole is on a rise. For the first time, it actually surpassed, what would have been lung cancer as number one in terms of cancer incidence worldwide. And it is now the most frequent occurring cancer worldwide. And that is specific to what is female breast cancer, which would be well over 2 million cases. And of that percentage, you only have, what is literally 1% of cases worldwide being what would be male breast cancer. To put it simplistically, for every 8 women who are diagnosed with breast cancer, then there's 1 man who would be diagnosed with breast cancer. And so then if you look at it, obviously, it is not at all a frequent occurrence, but yes, it is something that is possible. And so then we encourage the men, obviously, to also be alert. But again, it is not one of the frequent forms of cancer that you find in men, nor has it actually been demonstrated that we have a higher incidence compared to other years.
Okay. Kamara, do you want to share with us your experience, breast cancer and intimacy? What has been your experience like?
Well, when someone is diagnosed with, cancer or any form of illness, you first experience a whole range of emotions. And so my experience, as the doctor said, first and foremost, you're thinking about getting better, healing. And so sexuality and intimacy is not at the forefront of your mind. Mm-hmm. And it wasn't at the forefront of my mind. But over time, being human, I thought about it. I was in a relationship then, my partner seeing me going through this. How would this affect me and my partner, and so on. And so, like any human being, I experienced a whole range of emotions. And I would say, as women, because we are speaking about breast cancer, I'll focus on the breast. Now, from as early as the biopsy, we go through body changes. And so we have to come to terms with, the changes with our bodies. And there are 2 types of biopsies that can be done. And in the federation, we do the more surgical one, which is the excisional, where you cut and you remove the lump. And so, ladies, we have a lump and we have to look at that, and we think that we are less attractive, we are not sexy to our partners anymore, and our self-confidence, level, it will go down. And so it is something that we have to deal with on an emotional level. And sometimes we really do take it on. And so in terms of how it can affect someone with a breast cancer diagnosis, you really can look at different levels: the biopsy, the treatment stage, and after the treatment stage. And so when you're going through treatment can affect you in so many ways. As I said, you're worried about getting better, and you experience so many different side effects, some mild, some severe. And based on how you're feeling and your emotional state of mind, you have your partner and you want to do something, but you may not feel up to it because of how you feel about your body, your treatment, and the changes that you have gone through. So let's take, for example, you removed one of your boobs or even both. A lot of times it is hard for women to accept the changes or come to terms with it right away, but it is something that we choose for the fight and for life. And it takes time for us to feel comfortable with ourselves, much less to show or reveal our bodies to somebody else. And so it is a struggle. As I said, initially I thought that, hey, my boobs were a bit ugly, but I came to terms with my breasts and I love them now. I have ladies who I support, and we've had several discussions, and, removing a breast was not an option for them because it is something that we identify with as a woman. It is a part of our womanhood. So it's hard for us to have this removed and to show ourselves to persons in a way that we are not used to. And so it is definitely an emotional struggle, which then affects us physically and in other ways. And so because we are dealing with this emotionally and mentally, we simply don't have the urge to do certain things with our partner. Right? Mm-hmm. But one of the ways to overcome that is simple conversation and dialogue, understanding.
Thank God for supportive partners.
I heard Dr. Tate say something earlier, and I smiled because we go through these body changes, and I speak based on ladies in my circle and in my network. A lot of the times, our partners are not as concerned with the changes with our bodies as we are. But as ladies, it's something that makes us feel a little extra and, attractive. And so it is important to us. And so we struggle with that, apart from the treatment that we go through. Treatment can cause your body to change in several ways. And Dr. Tate alluded to some. You can have vaginal changes, which can include dryness, so many different things, depending on the type of treatment that you are on. How do you deal with this? You speak to your doctor. Doctor, because my situation may not be somebody else's situation because the treatment is specific. And so there are changes that I went through, my body went through. We will all go through when we experience a cancer diagnosis, but the important thing is to understand what your body is going through, speak with your medical team, and to speak with your partner as well.
Thank you very much, Kamara. Well put. Thank God for supportive partners. And everybody's case will be different. So know your case and you will act accordingly. Doc, I'm going to ask some questions. I will give you two of the many questions that we have here from all listening and viewing audience. If you had breast cancer, then you had children after, number one, should you have your children check, your girls check? And then after successful chemotherapy, is there a requirement to take any type of medication thereafter? Those are the two first questions.
I think the first question was, I think the first question was,
If,
sorry, we had a bit of feedback in
okay,
here.
if
The
you
first
were
question was,
if you were diagnosed with breast cancer, you had breast cancer, then you had children after, should you have the children checked? Especially if they are
oh,
girls, if you have them, should have them checked.
well, the truth is, any history in terms of family history of breast cancer, and we like to highlight what we would refer to as first-line relatives. Then we want to be mindful. It's not going to be necessary, to have the children checked, in terms of birth or anything along that line, because breast cancer is not something that would be passed on, through the womb or anything of that sort. And again, too, there are specific ages where you have what would be the higher incidence or likelihood for breast cancer. But definitely, if it is that there is a family history, whether it be mother, father, brother, or sister in particular, with breast cancer, then you as the individual, as an adult though, should emphasize on what would be your regular checks. And of course, too, just the fact that you are a woman, even without what is the history, family history of breast cancer, then again, too, you want to also emphasize on what would be the regular checks, because just being a woman is in fact the greatest risk for having breast cancer. Your the second question, if you could remind me or tell me, because as I said, we had a bit of feedback in here. I wasn't able to grasp
Okay.
it very well.
After successful chemotherapy, is there a requirement to take any type of medication?
Well, again, treatment comes back to what would be the stage of the cancer, and again to the biomolecular basis of that particular cancer. And so then you have patients who are cured after what would have been their surgery and then their chemotherapy. You have individuals who require what would be radiotherapy after they would have completed the chemotherapy. And then you have instances where patients may have to continue with very specific systemic treatments, for up to what would be a course of little over a year, according to the specific finding of that particular cancer. And then too, we have individuals who may benefit, not that it is absolutely necessary, but then we highlight what is the benefit of hormonal therapy in patients who actually respond to hormonal treatment, because then this is something that helps to prevent an early recurrence of the cancer. And so then this is something, according to the treatment that is prescribed, that generally may run anywhere from what would be 5 to 10 years in respect to the hormonal treatment. So again, it really just comes down to the specific type of cancer as well to as the stage of the cancer.
Okay, another question is, a woman who would have removed both of her breasts, would she be able to produce milk? No, for a newborn. Let me continue. Yes. Would a woman who totally remove her breasts be able to produce milk for a newborn baby?
Okay, so I should emphasize on the fact that if a woman is diagnosed with breast cancer, because of the fact that the sex hormone, and specifically, what is estrogen, estrogen is the enemy with breast cancer, and estrogen is in fact why we as women are at much higher risk than men for breast cancer, because we obviously have much more estrogen than they could ever have, right? And so then it's important to point out that once it is that a woman would have been diagnosed with breast cancer, and if she is still of what is childbearing age, then she is generally counseled, she's advised to avoid what would be a pregnancy for what would be a certain period of time. Obviously, we also highlight the fact that the risk for recurrence, it is greatest within the first 2 years. The risk for having the breast cancer return or having a new cancer of the other breast never actually disappears once it is that you have had breast cancer, but it is highest in terms of what would be the first 2 years. And so then generally we would advise that this woman should not return to pregnancy. And so then what happens is that in most instances by that time, obviously then there would not be a need to consider breastfeeding and so forth, because then time would have passed in terms of the reproductive age. However, we do have individuals who would require or who would request based on their specific desire in terms of having children and so forth. And if it is that after what is the recommended or the prescribed treatment they are able to, then in those instances, then we, we guide them so that they can be able to be safe. It really wouldn't make too much sense in terms of not be safe, have a child, and then, not be able to be there to continue with what is the care of the child. And again, according to what would be the type of surgery that would have been done. So if it were, for example, what is perhaps a partial mastectomy, then yes, absolutely, you still have, what is that possibility in terms of production of milk to be able to breastfeed. So that would be the short answer for the question. But unfortunately, it took quite a bit much more that needed explaining before that. So that would be the short answer. But if it's an instance of, a complete mastectomy, then no, there would not be what would be any production of milk in that particular breast, because then there would no longer be a breast to begin with or breast tissue.
Okay, good. Another question is, how common is lymphedema after treatment in the Federation?
The treatment for lymphedema, how common it is? To be quite honest, we try to highlight the fact that lymphedema is actually something that can be avoided. And we perhaps need to emphasize more on what is the prevention as opposed to what is the treatment for lymphedema, because lymphedema is exceptionally difficult to treat, altogether. But yes, there are some measures in terms of physiotherapy, but it never actually goes away once it is that you get to what is a more pronounced phase of the lymphedema. But yes, treatment is available, and it is something that we actually have within the Federation. So yes, it is here.
And then another question, if you did a biopsy on one breast, is it advisable to do one on the other breast?
I'm sorry?
If you have done a biopsy on one breast, would it be advisable to do one on the other breast?
A biopsy? No,
Yes.
not at all. Emphasis on breast examination, self-breast examination in particular, bearing in mind that, as we stated, the presence of the lump, this is the most significant and frequent occurring symptom. And so then there's absolutely no need to do a biopsy because you really wouldn't even know what it is that we have to biopsy in the other breast if it is that there is no lump. So what we want to do is emphasize on breast examination. And this is something that the woman should do every month faithfully. It should be separated from what is the menstrual cycle. So what would be the week or the time that a woman would have her menses. Then we want to make sure that it is done just about a week, 5 days to a week after that. And you check on what is the breast. You do that breast examination. And the more frequently you do that, then the more familiar you would become with what is the breast. And so then you'd be able to pick up, hey, this isn't supposed to be there. Hey, this is not what this normally feels like. And so then that is what we emphasize on. So no, not a biopsy, except if it is that the other breast also too then has a lump. Then in that instance, then it would be biopsied as well, or should be biopsied as well.
Okay. Ladies, we are getting valuable information from the doctor this evening. I'm hoping that you have taken good notes and you will reach out to her for further consultation. Kamara, we know that you are involved as a warrior and advocate for breast cancer. Just tell us some of the things that you have been doing in terms of bringing awareness to breast cancer in St. Kitts and Nevis.
Sure. Now, one of the things that, I do a number of things to help and support young ladies who are fighting and, to spread awareness as well. But I must say, you know, I refer to myself as a breast cancer warrior, and I feel it fitting to explain why. I remember in 2018 when I completed surgery and chemotherapy and all my and Kamara, you are cancer free. And subsequent, my labs have been normal. Now, I support a number of ladies who are still fighting. Initially, I refer to myself as a survivor. And because I am still fighting daily with these ladies, I said to myself, no, I am a warrior.
Yeah, we're not we're not hearing you. Uh, Her phone. her-
Sorry, I bumped off.
Okay.
We are having a bit of technical difficulties. We apologize. So I had to join the doctor.
Okay.
So I was saying, I refer to myself as a breast cancer warrior, and simply because I still fight daily with a number of ladies privately, of course. So first and foremost, I spread the word about breast cancer awareness. One of the things, and you heard this throughout our conversation, that there are different stages. And if caught early, it is treatable. And so not only about early detection, but encouraging ladies to stay on top of their medicals as well. And so that's something that I have personally taken on, both privately and publicly, encouraging persons to stay on top of their medical, not just in relation to breast cancer, because it can be so many other things. Let's talk about pap smears. Let's talk about other things. Do we do them annually as we are required? Now, when it comes to breast cancer, it is not easy receiving such a diagnosis or the doctor telling you that you're ill. And so some of the things I do include, I go to the doctor with these ladies. Now, when I was going through my journey, you heard me say that a lot of the times I wasn't able to think. And so I provide support to them if they don't have a family member or somebody to go with them. If I am free, I do any and anything that is required. Some of it I am not able to speak about because it is in confidence, of course. I also, where necessary, it can be a financial strain on the individual and on families. And when you are going through something like this and you're fighting for your life, financing is not something that you should be worried about. And so where I can, I mobilize support. I seek assistance for them. I help them to get the necessary things in place so that they can get the type of financial support that they require. So a number of things I do. I also partner with almost all of the breast cancer associations in the federation, because it's not just about one individual. We are all in this together. And so I partner with the different associations, whether it be Pink Lily, Essence of Hope, Reach for Recovery. We all come together to spread awareness.
Thank you very much for that. So, ladies, reach out to Kamara Lee Prentice for any information that you might need. She is only a phone call away and she's very willing to help to assist. Doc, I have one last question for you and then we will wrap up. More questions are coming in, but I'm going to cut off. This is my final question. Doc, what is breast pain normal after one would have had a total hysterectomy?
I'm sorry, I didn't get the question.
Is breast pain normal after one would have had a total hysterectomy?
I can't quite say, that it should be. Breast pain at any time is not normal. Obviously, once it is that a woman would have had a hysterectomy, then there are changes, particularly if it is that the ovaries would have been removed. And so then you can have little hormonal nuances. But I don't know if I would quite sum it up in terms of, pain. But what I would say is that any pain of the breast at any time, then, obviously it should be investigated. And so then, even if it is that the woman may or may not have had a hysterectomy, and you are experiencing any sort of pain in the breast, then it's something that you should have checked medically.
Okay. So, Doc, any final thoughts for this evening as we wrap up our podcast this evening? Your final thoughts. Are you?
Final thoughts?
Yes.
Sorry, we're sharing, so because we're having technical difficulties. In terms of my final thoughts, one of the things that I've realized is that women generally get scared and go into panic mode when you feel something. And so the first thing that they think about is breast cancer. And so I want to tell you, and research shows, and several persons have experienced this themselves. Every lump is not a cancerous lump. And so one of the first things that you do, if you feel something, get it checked. While it can be that, it also may not be that. And so I know that we often experience, different emotions, including fear, when we feel something. And it is normal because we are human. But I encourage you to first think positive, right? And we hope for the best. So get it checked. As we've been saying, early detection saves lives. If you find something, if you feel something, it doesn't make sense to sit at home and stay in denial. Get it checked right away. If it is that and it is caught early, we can beat it. And so it is important for you to get checked, pay attention to your health. If you are afraid to go alone, ask a family member or a close friend to accompany you. If you don't want anyone in your business because you don't want anyone to know about it and you don't want to say anything, you can reach out to us, one of the young ladies in the different breast cancer association groups, because I'll tell you, we are sworn to secrecy. And it will stay between us. And support is important. But if you feel something, don't stay at home in denial. Get it checked. We are here to support you. If you want me to accompany you, feel free to call me. Feel free to reach out to Pink Lily. Feel free to reach out to Essence of Hope. Feel free to reach out to Reach for Recovery. We are here to support you. Remember, early detection saves lives, and help is here for you.
Thank you very much, Kamara. Doc, your final thoughts? Mike? Mike? Okay.
I would say, I would say that I think that Tamara said it all, to be quite honest, in respect to the need for what is early detection. Early detection, that is the key. And as she alluded to the fact that, many women are still very fearful of what is a diagnosis of any cancer, breast cancer included. And so this is something that may paralyze them, with fear and not allow them to think clearly to the fact that this is something that they should move on quickly. Whether it is that you think that it is a cancer or you think that it may not be a cancer, once it is that you find what is a lump or anything in the breast that is unusual, then you should have it checked. So what we're appealing to you to do is to make sure that you don't stay at home. And I would pretty much say that, that is what I want to emphasize on. Also, too, just to highlight the fact that, at WellPoint Medical and Oncology, that is my practice, we also to provide what would be free breast examinations, to women. And so then if it is that you have, again, what is a concern, as Kamara said, perhaps you may not necessarily want to get,
individuals involved because you're not quite sure as yet, but have it checked. And again, our doors are open at WellPoint Medical and Oncology.
Thank you very much, ladies. We had a very fruitful discussion this evening. I am so thankful for your very rich discussion. I want to thank you for gracing us with your presence and giving us your time, even though we would have spent about 40 minutes trying to work through the technical difficulties. I also want to thank those persons who would have logged on the World Wide Web and would have sent in their questions. I want to say a big thank you to Mrs. Nadine Carty-Keynes and her team at the Health Promotion Unit, as well as our technicians from NNC and Mr. Carl Tyson and his crew, who would have given us real service here this evening. Once again, ladies, and ZIZ, how can I forget ZIZ, our partners who would have come through for us in grand style this evening. Cameraman Ounce, thank you very much. And I want to leave with all our viewing and listening audience. Early detection saves lives. We are in this together. We can beat this. Solid words from Kamara. And from our good doctor, please reach out to WellPoint Practice. Did I get that right? WellPoint Oncology Unit. They do free breast screening as well, and you can get your consultation as well. Ladies and gentlemen, thank you very much for listening. Other members of the crew, Ms. Chevrolet Nisbet, Ms. Sheila James, thank you very much for this very impressive first time podcast. Once again, thank you, ladies, for your wealth of knowledge. Have a good evening. Get home safely. Thank you.